I've done a video on Botox for scarring in the past. I don't even think that long ago, but this is my sort of Botox series of innovative thoughts on Botox. I've mentioned that they've done double-blind, prospective, randomized, split scar controlled studies looking at the healing powers of Botox on scar tissue. And I'm convinced that it's an insanely powerful therapy, because what I've seen on terms of even my own skin has radically shifted just a month out from my meso-Botox treatment. I think it molecularly heals the tissues and allows a much better result on the long end, and it's safe in all skin types. So my mainstay of therapy since 2007, this is 2023, so for 16 years, has been 5-fluorouracil, 5-FU for short, mixed with dilute triamcinolone acetonide or Kenalog, 10 milligrams per cc, done in a 3-to-1 mixture for scar tissues. However, those therapies are not entirely immune from problems, including, I've seen in darker skin types, a violaceous color, a purplish color that can persist for months, risk of even some level of atrophy to the tissues. And with Botox, there are really almost no issues with it. And one of the things I've been really understanding is I've been continuing to dilute my Botox down, and I'm finding something from a cognitive perspective that I don't think you'll probably quite understand. But the way to understand is that high concentrated Botox is needed for muscle reduction to minimize the movement of the muscle. But you don't want that when you're treating scars, because if I treat a scar here, I don't want the person not to have a normal smile. And I've really worked on improved dilutional amounts of Botox, and I'm seeing ongoing improvement in scar tissue without the side effects of smile compromise or movement compromise. And I'm continuing to work on different dilutions and experiment with those therapies. And I'm seeing a molecular healing of the skin and the scar tissue that I simply have not been able to see with almost any other therapy out there, including 5-fluorouracil. And so the safety margin is absolutely outrageous, in my opinion. And the molecular healing is so much stronger. So now if I've got a scar that's less favorable, I'm actually doing it every month. And so the one thing I talked about in some other videos, but it's hard because I shoot so many videos for you to probably keep track of all my ideas, but I really believe this whole thought process of 90 to 120 days is rooted for an interval with muscle treatments. But muscle treatments, in my opinion, is not at all what I want to treat. It's antithetical to what I'm treating. But I really believe that with these treatments that I'm doing, the interval doesn't matter. I could do it every week. Right now, I'm finding that a monthly dose for severe scars is really the best thing, even elevated scars, all types of scars. Botox has become my number one therapeutic intervention. So if I take a mole out, whatever it may be, I love Botox in terms of managing that. Now, of course, it does not allow you to be sloppy as a surgeon. You have to have the ultimately best surgical excision you can. But Botox is the most powerful healing agent on planet Earth, in my opinion, especially for scars.